Today I wanted to talk to you all about how we can use nutrition to optimize cancer treatment. And to go over what we'll talk about today, I wanted to talk about gastric cancer at a glance, how nutrition affects the overall trajectory of the disease. The surgical treatment I'm sure you're all aware of, but just talking about how that will affect nutrition. And then some things to expect after the operation and what you can be eating during this time, how you can be optimizing your health. And then just some troubleshooting for some symptoms and side effects you might experience and what we could do. And then I heard there was some interest in this room about probiotics for gastric cancer, so I'll be touching on that and telling you a bit more about the research. So as I'm sure you all are aware, gastric cancer is unfortunately one of the cancers most affected, that affects nutrition the most. So because of the physiology of cancer itself, as well as where the tumor is located, cancer affects cells that turn over rapidly, and cells that line the GI tract are some of the fastest turning over cells in the body. So some things to expect are many patients will experience malnutrition during the course of the treatment. The good news is there are ways we can work around it, and I'll be talking about that soon. So we know malnutrition is problematic, but why in particular? So the type of malnutrition that you may experience during cancer it's called anorexia cachexia syndrome. The reason that it happens is because your body you're going through so many changes at this time. Your body's secreting more inflammatory molecules, and because of that, it's changing the signaling throughout your body. So you might be getting signals to your brain that you don't want to eat, and it's not by any means like a behavioral thing. It's really just a matter of the physiology of the disease. And because of that, the inflammatory molecules will also change how your body's metabolism works. So you're breaking down more protein mass than you're building up. And then as a result of that, you're losing lean muscle mass, which is something that is really critical to how you'll recover. So of course, malnutrition is obviously not a good thing. And the good news is, again, that we can work to optimize it. And I wanted to add that BMI is a diagnostic tool. And as you're going through the treatment, it's important to remember that BMI is not a good indicator of nutritional status. For many of us, we've been taught a lot of diet culture throughout our lifetime. And while someone may diagnostically fit in the overweight category for BMI, that by no means is a good indicator of their nutritional status. So just something to keep in mind. So the primary treatment options, if one is to undergo surgery during this time, is a partial or full gastrectomy. I'm sure you all are aware of how this works, but depending on where the surgery or the tumor is located, in a partial gastrectomy, we're removing the lower portion of the stomach, and we'll either reconnect it here to the upper portion of the small intestine called the duodenum, or the lower portion called the jejunum. And if it's reconnected to the jejunum, it creates what's called a blind loop here, where there's this pouch where the duodenum was sealed. And because of that, you're reducing the gastric volume. So that means the size of your stomach is obviously reduced. And then you're changing the transit time within your stomach. So things aren't flowing exactly as they did before surgery. And then it's also, of course, affecting your digestion, because the stomach is important for where you're going to be breaking down protein in your diet. It's going to be where you're absorbing nutrients like iron and B12. So obviously these things will be impacted by surgery. And a full gastrectomy, again, that is a little more complicated, but we're reconnecting the esophagus to the small intestine and removing the stomach. So some changes to expect. Your body is going through a state of catabolism, which means it's on high alarm. And people who are admitted to the ER for various states, they experience catabolic states. So that means that your body's breaking down molecules. It sees an emergency signal and it's trying to mobilize resources for it. So things like your protein mass, so your lean muscle mass, will be breaking down so your body can respond to what it deems a threat. And in this case, the threat is obviously the cancer, but also the time right after surgery. And then, of course, since you're reducing the size of the stomach, that's less surface area for the food to be digested. So that means that you can't eat as much, you get fuller faster, you might experience some side effects as a result of that. And then malnutrition scores can increase by 30%. Another issue is the change in the bacterial balance. So we have microbes lining our GI tract, primarily in the large intestine, but because of the reconfiguration of the GI tract, that will change as well. And another thing to be mindful of, recovery takes time. It can take 6 to 12 hours for the small intestine function to resume after surgery. It can take up to a year to get back to where you were pre-surgery. Okay, so I wanted to talk about what to eat after surgery. I will say with the caveat that please speak with your physician about the details of this, but this is a general template of what to expect. So if you're thinking about you just experienced this major event of surgery, you're trying to think of what you can eat again, you want to just ease into what your body can handle. So in the first phase after the diet, once you've been cleared to consume clear liquids, some ideas for what you can be eating. Broths might be a good option. Clear juices like apple juice or cranberry juice, you might want to dilute them so the sugar is not too intense. If you are able to tolerate dairy, I will say with the caveat, some people are no longer able to tolerate dairy during this time. I see some nodding. So if you can though, kefir might be an option. It's a fermented dairy drink. And then I listed this Premier protein beverage. Protein is your best friend during this time. You'll need the protein to be building your protein mass back up. And we want to be having drinks or foods with higher protein and lower sugar. And then once you're cleared for the liquids and soft foods, then here are some ideas. Obviously, diet is so individual and our tastes vary incredibly, but if we want to be thinking of what's nutritious and will help our body during this time, we want to be introducing food one thing at a time. If you have two things at once and then you don't feel well afterwards, it's hard to isolate what exactly caused the symptoms. So thinking about, we could have pureed mashed potatoes or sweet potatoes. We don't want gas-forming vegetables, so you think of like broccoli and cauliflower and those kinds of foods that are very healthy, but during this time you just want to ease back into it. Scrambled eggs are a good option because they're high in protein, easier to digest. And then if you like, again, if you can tolerate dairy, fat-free cottage cheese is a good option because it's higher in protein, etc. And then once you're easing back into eating full foods again, we can think about, again, once your doctor has cleared it, soft cooked vegetables are much more easily digested than raw vegetables. So things like sauteed zucchini or baked or roasted vegetables are a good option. And for protein sources, if you like tofu, that's a good idea. And then when we're eating meat, red meat may not be tolerated at this time, but we can think about maybe like a baked chicken during this period. Now, nausea. Nausea is fairly common and obviously doesn't feel well. So we can think about, well, why does it happen? The size of your stomach has reduced significantly. So it may be something as simple as if you ate too much, your body can't handle it. You might experience nausea from that. Of course, the medications and the treatment course itself can cause nausea. But some basic troubleshooting ideas for how to address nausea. We want to be eating slowly. So give your body some time to respond to the food, for the signals to go to your brain, etc. Hydration is obviously key during this time. And similarly, smaller portions. Cold foods may be better tolerated. Again, these are general tips, but it's highly individual. But for some reason, cold foods may be easier to tolerate. And then ginger is wonderful for nausea. If you like ginger, it's great. You can have it in tea. You can use it in cooking. If you like oils, like essential oils, that's an option. There's like ginger essential oils. There's lemon. There's peppermint and lavender. So if that's your jam, that's great. And then nausea may also occur due to odors. So you may experience heightened sensitivity to odors. So for caregivers and those taking care of them, you might want to think about when you're cooking in the house, opening the windows, baking food instead of sauteing it, because then that releases the molecules in the air that create the odor. And then also being mindful of what you're using to clean the house or scented perfumes, etc. They might just induce more nausea for individuals. Now, taste changes also may occur. The complicated thing with this is that in some cases, people have a heightened sense of taste, and in other cases, it's dulled. So again, it varies per person, but in the event that someone is not feeling that they can't taste foods as they used to, then you can use flavor enhancers. Acidic foods, if you're not having sensitivity in your mouth, are a good way to do it. So thinking about adding like vinegars and lemon and lime to your food. And if not, you can add spices, and those are great for anti-inflammatory effects in general. If you're finding that you're sensitive to taste from before, some people can no longer eat the things that they used to love. Spicy foods might be irritating. Greasy foods are, of course, harder to digest. So just be aware that individuals' preferences may change, and we want to honor what's going on there. And then some individuals might experience a metallic taste in their mouth, which is obviously very unpleasant. So an easy workaround is using plastic utensils. Or you can do a mouth rinse before eating to help with flavor perception. So you can use half a teaspoon of baking soda and water and salt and just swish it around in your mouth, and that may help with the tastes. Now, diarrhea and constipation, two opposite problems, but for diarrhea, a lot of the reason that it happens, again, is because fluid is rushing into your intestines too quickly because of all the changes. So some ideas for limiting diarrhea. So with all the interest now in what's called the FODMAP diet, has anyone heard of that before? No? Okay. Well, the FODMAP diet, long story short, is a diet plan for individuals primarily with IBS. However, it does have applications to other GI disorders. And so the idea of the FODMAP diet is that you're reducing highly fermentable carbohydrates because those can induce symptoms in people with compromised GI tracts. So it's a very complicated diet that requires a lot of assistance. However, the basic idea is that for managing diarrhea, we could limit foods high in sugar, especially concentrated sugars like fructose. So anything with high fructose corn syrup might induce diarrhea in some individuals. Sugar alcohols, so things like breath mints, chewing gum, etc. So limiting things like that. Another thing to consider is, again, your tolerance for dairy may change, so you may not be able to tolerate lactose anymore. So thinking through if there's a lot of dairy in your diet and you're having diarrhea, that's something that could be changed. And then speaking with your doctor or dietitian to see if there may be an issue of fat malabsorption. That's also an issue that could arise. And in the event during an acute state, if you're having a lot of diarrhea, thinking about rehydrating and getting appropriate electrolytes. So low sugar rehydration solutions like the G2 Gatorade is a lower sugar option. So those are some ideas. And then for constipation, you could be having warm prune juice. Not the most exciting beverage, but it's helpful for constipation. And then there's some interesting research coming out now from University of Michigan talking about how kiwi can be affecting constipation. So in this case, if you want something easily digestible, you could blend it, and that may help with the constipation. But in general, we want to be increasing fiber as much as we can tolerate, and then staying hydrated. Now, GERD is gastroesophageal reflux disease, and that may occur because, again, your stomach size has been reduced. So some basic tips are we want to be sitting upright after meals. When we're laying down, the valve between our esophagus and our stomach can relax, and because of that, the food can creep up into the esophagus. So just staying upright and allowing the food to settle into your stomach is an easier way to help with the GERD. Similarly, we want to avoid laying down. I will say that that's the opposite thing with dumping syndrome, but I'll get into that. And then some foods that might be causing GERD or exacerbating it, rather. Tobacco, of course, is not going to help with that, but caffeine, and then some healthy foods like citrus foods, tomatoes, chocolate, unfortunately, mint may all be triggers for individuals. So if you're experiencing some of that, it might be worth assessing if that's in the diet. And then dumping syndrome. Dumping syndrome is what happens when there's a rapid shift in the fluid cavities in your body. So there's a high, what's called osmolar load. It pulls food into the intestines too quickly. And then because of that, your body is trying to adapt. So then it shifts fluids from different cavities in your body rapidly. And because of that, you may experience some abdominal cramping, some diarrhea, some really unpleasant symptoms like dizziness and lightheadedness. So some workarounds for that: limiting simple carbohydrates is going to be your best bet. So thinking of having brown rice versus white rice is one idea. And then separating liquids from solids to help space out that fluid distribution. And then sugars are also going to be osmotic, so they pull the food where you don't want it to go too quickly. So keeping sugars under 10 grams per serving roughly will be helpful. And then another tip is just adding a protein or fat to help slow down the process and help foods move through gradually. All right, so we covered a lot so far. I also have background in public health, so I'm always thinking about the bigger picture of the environment that we're in. So from a meal timing standpoint, again, it's easier on our digestive tract if we're having smaller meals more often. If we think about the environment in which we're eating, experiencing cancer is obviously a very traumatic event. It can be isolating. And so what we can do in our psychosocial environment, thinking about eating the foods that we enjoy during this time, is helpful. I will say that if you're feeling nauseous, don't do that, because then you might associate, if you end up vomiting, associate that with your favorite food, and that's not good. Having food in the company of others is also important to help during this time. And then listening to your body. If you are not feeling like having an elaborate meal, of course, eat something, but eat something bland or whatever is best tolerated. And then some tips that we talked about for nutrition. Cooked foods and pureed foods are your best bet for easily digestible foods. Protein is key during this time. We can talk about some protein sources that are good. And then for weight loss especially, we want to be thinking about higher calorie foods, which we'll talk about in a bit. So these are some ideas. Again, nutrition is so specific for individuals, but some drink ideas. If you're not feeling up to eating something, but you know you haven't had anything in a while, these protein shakes, there's so many on the market now. I will say Boost is kind of higher in sugar, but it's more economical, so it depends if you can tolerate it. So these are some ideas for lower sugar protein drinks and then electrolyte drinks. For meals and snacks, again, the general template is we want to eat what we feel like eating, eat protein at every meal or snack. So whether that's eggs, whether it's whole wheat pasta, whether it's meat, whether it's beans, we want to be thinking from that standpoint. And then some ideas for how to boost calories during this time. Fat per gram has more calories than protein or carbs. So counter to what we may have been taught our whole life, we want healthy fats during this time. So if one can tolerate nut butters, that's a good way to increase the fat and calories in a meal and helping those who are not keeping on their weight. And then avocado, very popular, high in fat, but the healthy fats. And then thinking about olive oil and avocado oil, etc. Those are good additions to increase the calories at the meal. Now, probiotics. So probiotics are a very hot topic, and a probiotic is defined as a microorganism that, so probiotics, they're microbes that exist all around the body. So mostly we're concerned about what's in the GI tract. We have microbes on our skin and our eyes, etc. But in the GI tract, we have over 100 trillion bacteria, which is an insane amount. And they have co-evolved with us so that we provide the environment for the microbes, but then the microbes are serving us because they're fighting off pathogens, they're harvesting energy from food, and they're there to help us and protect us. So with that being said, all the interest in probiotics now has evolved because we're learning that our environments have changed significantly even in the last 50 years. There's some thought that our environment might be too quote-unquote hygienic, and that might be contributing to shifted microbiomes. We don't necessarily have a template for what a healthy microbiome looks like. We know that diversity is the best indicator, but on the whole, we want a diverse microbiome, and in the state of gastric cancer or any other GI disease, we know that there's a change in the microbiome. And because of that, there's changes in the whole inflammatory signaling and the immune process. So that's the thinking as to why it might be beneficial for gastric cancer. So this was a study, a randomized control trial conducted in 2019, earlier this year in China. They took 100 patients, split them half male, half female, individuals who underwent partial gastrectomies. And what they did was they provided probiotics to individuals after surgery for 6 to 7 days. And they took blood markers to measure their immune signaling. And then they also took samples of their stool to see what changed in their fecal matter as far as the microbial distribution. So it was the first study of its kind and obviously very relevant to this audience. But what was interesting is this graph here. You can see, so the one on the left, that's the before the probiotic treatment. That's before the surgery. This is after the surgery in the middle. And then the rightmost bar is after the surgery with the probiotic therapy. And what you'll notice is that the colors, the shifting of the colors represents the changes in the overall types of bacteria in the gut during this time. So after the probiotic, we see that the general amount of bacteria, or not amount, but the distribution of different species has changed. So that's a good thing. What's the catch? So the catch is that there aren't a lot of studies that have confirmed this finding. Probiotics are extremely exciting, but they're highly complex. So we're starting to learn the various ways in how one strain can affect one specific disease. And I think eventually we'll get to the point where we can use them in a way to benefit very specific conditions. However, so this is exciting. It was a small sample size, so it was 100 individuals, and most of their findings were related to the blood markers. So rather, we don't know qualitatively how it affected individuals. That being said, probiotics may be something that you want to talk about with your doctor. I will say it absolutely is something that has to be medically managed by the doctor, because there are cases where probiotics can affect individuals adversely who have compromised immune systems. So some quick tips for if you want to be looking into probiotics. There are so many on the market. It's insane how many there are, but we want to be thinking about as specific of strains as possible. So it might say like Lactobacillus acidophilus on the label, but that's not specific enough. Some of them go on to list the numbers and the specific types of strains. So we want to be thinking of that. But I will say work with your doctor or dietitian to figure out one that works best for you. So we covered a lot today. We talked about malnutrition, how we can use nutrition for symptom management, and then I will leave you all with the idea that nutrition absolutely should be part of your care plan. With all the complex changes that are happening during the course of the treatment, nutrition is your friend. So I want to say, if you find a doctor and a dietitian who you trust, who can help you figure out what kind of diet plan works best for you, and potentially thinking about supplements and probiotics that might fit your needs best. And that is it. Thank you. Are there questions? Yes.
At post-surgery, what is the ratio protein, fats, and carbs?
Sure.
Rich in fat and protein and low in carbs, kind of hard to do.
Yeah. So I will say there's no perfect ratio. And even as someone who looks at the numbers of different dietary facts, et cetera, the general template you want to be following is we want to go lower carb, lower fat, higher protein. So if you look at a plate, a typical like healthy plate is thought of as 1/3 protein, half non-starchy vegetables, and then 1/4 starchy vegetables. Or so you can be thinking during this time, if you're having a plate of food, even if it's a small plate of food, just filling half of it with protein during that time, and then having a little fat on top, maybe putting some extra oil on it, and then having, say it's like half chicken and then some white rice on the or brown rice on the side. But there's no perfect formula, and you'll find that it's obviously is very different per person. But yeah, just thinking in terms of you want a protein at every meal or snack, and then a carbohydrate and just a little bit of fat. So Does that help? Sure. Yeah. Yeah. And I would say too, like you're not trying to restrict what you're eating too much either. So if it's a matter of not necessarily reducing carbohydrates, but maybe just adding more protein to the meal, that's one way to think about it. But uh, what's like an example of a meal that you have where it's harder to get more protein? So yeah, like for breakfast, you might be having like eggs, you can have nut butters, you can have beans if you want to. So I hope that helps. Yeah, yeah. Any more questions? Great. Well, thank you so much.